Monday morning hits the clinic, and there is a queue. Not a line of patients in the waiting room, but a prior authorization queue. 35 to 40 pending Blue Cross Blue Shield requests sitting on a screen, waiting for action, with 5 urgent submissions due before noon. The 2024 American Medical Association survey pulls the exact numbers on this routine. Physicians and their staff are completing an average of 39 prior authorization requests per physician every single week. That adds up to 13 hours dedicated entirely to submission, follow-up, and appeals. For a 2-physician practice, 26 hours every week are absorbed by a workflow that does not directly generate a single dollar of clinical revenue. Prior authorization has shifted from a minor clinical hurdle into a central operational cost that most groups absorb without measuring. It is a daily friction point that drives 89% of surveyed physicians to report experiencing burnout. Dealing with Blue Cross Blue Shield specifically adds layers to this process. It is not a single entity, but a fragmented family of commercial, Medicare Advantage, and Medicaid plans. A drug that qualifies under one plan may not qualify under another, and their payer policies rotate quarterly. Then come the peer-to-peer reviews. Treating physicians spend hours explaining established clinical criteria over the phone to the payer, yet only 15% of physicians report that the reviewer on the other end is actually qualified to make the clinical determination. This chart shows the overturn rate for appealed prior authorizations. According to Medicare Advantage data analyzed by KFF, over 80% of appeal denials are ultimately overturned. That high overturn rate reveals a distinct pattern. A very large share of initial rejections are not based on medical necessity. They are administrative traps, rejections for a missing prior therapy log, an unaccepted PDF type, or a mismatch with the payer's current policy version. Most practices are already struggling to keep up with the incoming queue. They simply lack the internal bandwidth to build files and fight every single administrative rejection, forcing them to walk away from legitimate, earned revenue. The high denial rate functions as a systemic bandwidth test. Practices lose the revenue not because the medicine is wrong, but because they are under-resourced for the administrative fight. Given the recurring costs of staff turnover and policy training, a growing number of practices are concluding that internal staffing is not a sustainable fix. Instead, they are moving the workflow to external teams. They turn to dedicated teams at Staffingly. This creates a hybrid solution, combining the processing speed of AI data retrieval with the clinical judgment of human AAPC-credentialed prior authorization specialists. The service operates directly inside the practice's existing electronic medical record system. Access is routed through an encrypted VPN under a strict business associate agreement on day 1, meaning no data reentry is required. By moving the process off-site, prior authorization transitions from an unpredictable internal bottleneck into a predictable external utility. First, AI reads the clinical chart, matches BCBS policy, and drafts the narrative. A credentialed specialist reviews and submits it. The system tracks CMS compliance for the 7-day standard. If denied, an AI appeal agent instantly builds an evidence pack to fight it. For peer-to-peer reviews, the preparation is done in advance. Physicians receive briefings with chart highlights, prior therapy timelines, and exact policy citations 30 minutes before their call to ensure they have the evidence to win. The AI handles the automation of data retrieval and orchestration, while human experts retain the critical clinical judgment, ensuring maximum accuracy on every submission. The fully loaded annual cost of one in-house prior authorization coordinator, including salary, benefits, training, and turnover, runs between $55,000 and $84,000. By moving to Staffingly's outsourced model, that cost is replaced by a streamlined weekly rate starting at just $399 per position. Practices get a dedicated team producing faster results for a fraction of the price. Standard turnaround time drops to 4 hours, and expedited submissions go out in just 60 minutes. Outsourcing prior authorization is a direct reduction in overhead that immediately clears the submission queue without the need for additional headcount. Implementation is fast. A practice can go live, integrate the system, and eliminate their pending queue in exactly 5 to 10 business days. To prove the model, Staffingly offers a 2-week risk-free pilot, scoped directly to your practice's busiest Blue Cross Blue Shield queue, with no long-term obligations. Book a demo today. Stop letting administrative bureaucracy dictate your practice's profitability and your staff's sanity.